We welcome now Cade Yates, Deputy State Director, Americans for Prosperity, Mississippi. Hey, Cade, good to see you. Thanks for coming in.
Absolutely. Glad to come on.
So we're going to shift gears a bit. We've been talking about the economy and the big stock market sell-off today, but here at home, there is a set of policies that your organization has been advocating to repeal, known as the Certificate of Need laws. Tell our audience exactly what those are all about.
Absolutely. So a lot of folks call them con laws or CON laws, but Certificate of Need laws were originally set up on the federal side under the Ford administration to actually try to get the quality of healthcare up, reduce the amount of expenditures on wasted services, and drive down costs, and also try to get services to the most poor and rural areas. Unfortunately, they found out after a few years that this did not work, and under the Reagan administration, they removed these federal guidelines and sent it back to the states. And now we're sitting in a place where a lot of states are looking to repeal these laws, or have repealed these laws, or don't have these laws at all. So our organization has been working on this. I've been with the organization 6 years next April, and this has been my number one priority since I got to the organization.
Well, how many states still have CON laws on the books?
So there are 15 with 10 or less areas covered, and the most of the areas covered by con is Hawaii with like 28 areas. So you can kind of see there's quite a few places that have a lot of these and a lot of places that don't. We have 11 states that do not have con laws. That's over 100 million Americans without con laws that are over their healthcare systems. And so there's 24 states that actively have 10 or more con laws and have done, and a lot of those are actually doing significant work. States like Kentucky, Oklahoma, Tennessee, West Virginia, Georgia, Iowa, Virginia, all have done significant work. And we actually, I looked it up earlier, 57 bills in 22 states are actually being worked on currently to try to work on a certain level of reform of these laws. Neighbors, Tennessee and Alabama have already done or have done some work, or Tennessee's done some work. Alabama's doing work now. Arkansas is doing some work, and Louisiana, which only has 7 areas covered by con, is actually looking to reduce some of theirs as well. So Mississippi, we don't want to be behind the curve, and our state actually covers 19 areas of con. So that can be anywhere from MRI machines to ambulatory surgical centers, home health, long-term acute care, big ones last year, birthing centers, mental health, and substance abuse facilities. So it covers a lot of different areas, a lot of equipment, and for us, it limits the capabilities of the state to be flexible for existing facilities, and then allow for new facilities to come in and have an opportunity to serve Mississippians. I mean, we really do believe that there is a servant's heart for a lot of folks in the healthcare industry, and we want to open up the market as much as possible. I know a lot of folks say that it's not a free market, but at the end of the day, we know that free market principles work, and we want to make sure Mississippi is open for business as possible for folks to come in and serve Mississippians, and then also existing facilities to expand their operations and be flexible with how the markets change and how variables change with communities.
So there are a number of I guess, laws on the books, regulations, if you will, that require obtaining a certificate of need.
Yes. Yeah.
So talk about those various categories.
Yeah. So, I don't think I mentioned this, but certificate of need laws are if you want to come into Mississippi or come into one of these states that have con laws and invest in healthcare industries by opening up a new facility or expanding existing services, you have to go before a board, prove that there's a need in that community, and then unfortunately on that backside you generally have to deal with competitor veto or competitors coming in and issuing comments on whether you should be approved or not. And so with that process, like I said, you have to cover ambulatory surgical centers, which have become wildly popular across the U.S., and they have actually been helpful in reducing a lot of costs, a lot of outpatient surgeries, home health, intermediate care facilities. We've got new hospitals, hospital size investments, equipment like MRI machines, CT machines, PET machines. So there's open heart surgery. There's 19 areas that are covered. And like I said, last year, House Bill 848, which Representative Lee Yancey sponsored, and made it all the way through. This is the first time this bill or these laws have ever been challenged in this way, and made it this far, made it all the way to conference weekend. Covered birthing centers, mental health, and substance abuse facilities, which have a high approval rate, but unfortunately we've got to see some significant improvements in these areas. So we'd love to see these laws get out of the way, and for investors to see that there's not a barrier in the way that, again, the process is not crazy, but at the end of the day, individuals still have to come here. They have to spend a lot of money on lawyers and going through the process, and the state of Mississippi actually has to spend quite a bit of money working on this program and keeping this program maintained. And then on the back end, all these folks who are wanting to open up facilities, whether in-state or out-of-state, generally have to deal with their competitors suing them on the back end to keep them out.
Well, so when you deal with the legislature and you talk about this repeal of these policies, when they say they're not with you, what's their rationale for it?
Well, I will say to start off, I don't think I've ever met a member of the legislature who said that the system is perfect and we don't need to change some aspects of it. Okay. But at the end of the day, the arguments against it are generally cherry picking, which is a practice of the hypothesis. If you open up facilities in an area that are competing with a local hospital or folks who are dealing with a lot of charity care, then you're going to that hospital is going to suffer and close down. Our research and the research that we've done across the U.S., and there's a lot of folks who work on this area of healthcare, have shown that that's not the case. There's a lot of states that have similar, like Iowa, Kentucky, and West Virginia have similar populations, similar Medicaid size of population. Those are the ones that are trying to repeal. So those are the ones who are with us. But states like South Dakota, Texas, Florida, Wyoming, rural states that have high urban population but also have significant rural populations are seeing that this is not the case. We're not seeing that cherry picking or skimming is a major problem and cause hospitals to shut down.
Are you aware of any hospital operators or just any other clinical institutions that have said, yeah, if I could get a CON, I'd open up whatever they do in their category of healthcare?
Yeah, so I will say I don't have a specific example other than what I've heard last year at a state affairs committee, where a local company wanted to open up facilities in the Delta, and they went through the process, were actually approved, and then on the back end they were sued, and after the legal battle with several hospitals in the Delta, they just said, hey, I'm just not going to open a facility, and they quit pursuing opening those clinics. But I know there are other opportunities. We actually have a online resource called Permission to Care. If you go to permissiontocare.com and go to Mississippi, it actually breaks down a lot of our cases that have happened in Mississippi, a lot of the institutions that have applied for a CON and either gotten it, not gotten it, gone through, stopped halfway through because of the litigation piece. I think our state has a lot of opportunities to work on CON and to join a lot of these other states that are working on repealing or have repealed at some level. And so there's a lot of opportunities. And I will say another thing that people say is that it closes rural hospitals. And some of our research, a December 2020 or 2021 analysis actually found that there's no correlation between like rural hospital closures, which is generally where a lot of people say that the CON laws will affect the most. But the states with the most hospital closures, Texas, Tennessee, and North Carolina. Texas doesn't have CON programs. Tennessee and North Carolina have stringent programs. Now, Tennessee in the time between now and between 21 and now has actually reformed a lot of their rural programs. And then the states with the fewest hospital closures, Maryland, Alaska, and Wisconsin, Wisconsin doesn't have con, and Maryland and Alaska do have con. So we don't see a correlation with that.
If you want to hang around, we got a break right here. We can continue this discussion about the Certificate of Need laws in Mississippi. We've got Cade Yates, Deputy State Director for Americans for Prosperity. Coming right back. Stay with us. Studio, Cade Yates, Deputy Director, State Director, Americans for Prosperity of Mississippi is our guest. And Cade has been focusing on persuading our legislature to repeal some, if not all, of these Certificate of Need laws. As I recall, Cade, when I was more involved in this issue, in fact, worked with AFP a few years ago. You remember there was a big push back then. It's been a push for a while since AFP's been here, honestly. This has been a core mission. But as I recall doing some research, this all got started in the 70s in New York, seems as I recall. And then it proliferated across the country, and then many states, however, since then have repealed those, as you indicated in the last segment.
Exactly.
Mississippi's remains. So this is a situation, you talked about legislation that Lee Yancey championed this year. He has in the past as well.
Yes.
This year we got it through the House. As I recall, in the 23 session, it died in committee.
Correct.
In the House.
Like every other time.
Like it has historically. That's right. And as I recall, some members of that committee took a walk during the vote, were unwilling to essentially cast a vote, participate in the voting in committee on the repeal. Now, I think that was full repeal, as I recall.
Yeah, there's been several different bills of full repeal, partial repeal. We've worked with a lot of folks in the House and in the Senate to talk about what are the options. I'm always transparent with folks. I always say this is not going to be the be-all, end-all solution for health care in Mississippi, but it is a great first step to start walking towards a better, more free market option. And the funny thing is in the last 2 years, we've done a lot of really great work on research. Like I said, the Permission to Care document, which lays out kind of a overview of the con process in Mississippi, and it also includes some fun pieces like every administration since Reagan has implored states to get rid of these laws. The FTC has implored states to get rid of these. DOJ. There's so many federal pieces that are like, these laws don't work, and we have to get them out of the way. And some other stuff that we've done is we did a study with Dr. James Bailey on how it affects Mississippi, and he found that 16.8% of a reduction, and this is if Mississippi were to repeal con laws, we would see a 16.8% reduction in Medicaid spending as a state share of GDP, 14.9% reduction in Medicare spending as a share of state GDP, and a 5.3% reduction in spending of healthcare share of annual personal income. That translates to around $400 annually per person. And so we've been able to, and also there's been some incredible work. Like South Carolina a couple years ago went from 17 areas of con to 1. Florida has done significant work on getting rid of theirs. New Hampshire did a full repeal in 2016. North Carolina has worked on, which is probably the most egregious outside of Hawaii. They have the most areas covered by con. Tennessee has worked on it, like I mentioned previously. They actually exempted hospitals in economically distressed counties to help try to relieve stress there. And Montana repealed all requirements for con except for nursing homes. So we've seen a lot of folks come around to this idea because, it really has started over the years, and we built on it, and we've partnered with great folks. Mississippi Center for Public Policy did a study with Matt Mitchell from the Knee Center on it, on a full breakdown of con, which goes through not only the arguments for con or against con, but also some of the solutions, policy solutions. And, we've had a lot of great folks like Institute for Justice, Pacific Legal Foundation, our national folks, Knee Center. There's a lot of folks who are working on this issue nationwide, and we're hoping Mississippi will be the next state that really dives in. And recently, we've had some really great conversations about certificate of need because, Gerard, I don't know if you saw, there was an article about a local fight about con between a local hospital and someone trying to come in. And for us, I won't comment on how that should turn out, but we see that con laws just drive up cost of healthcare, and we're seeing in this case that this is an attempt to deny their competitors the ability to deliver the services need in a community. I mean, this is mental health, and honestly, for us, it just hangs a big sign on our door. Don't come to Mississippi. Don't invest in healthcare here, even though we have talented doctors, talented physicians, or talented nurses, talented medical professionals across the board. There's a lot of opportunities, and we see that if these con laws were repealed, we could see some really great impacts on not only the financial state of Mississippi and how we're spending money on healthcare, but also, hopefully it'll give options for providers to maybe have reduced burnout and to have less, stuck in one option. They can go other places and have competition in the marketplace for higher wages.
Kate, for most people, their healthcare expenses consist of healthcare insurance premiums. Mm-hmm. So there are all sorts of reports from that industry that we can expect another premium hike in 2025. That's after we had a premium hike in 2024. Have you talked to any of the insurance companies, or more importantly, does your organization have the position that if we repeal the CON laws that we would see a decrease in healthcare insurance premiums?
Honestly, we've had some conversations in the state, but not deep conversations around the insurance side. But there are a lot of other states, specifically, like I mentioned, South Carolina, that had a lot of the healthcare or a lot of the insurance companies come alongside and say this would help us quite a bit on trying to reduce cost. But like I said, in Mississippi, our conversations have been with legislators and folks on the ground. We're a grassroots organization that goes out to every community across Mississippi, and when we bring up these laws and we bring up this conversation, individuals are seeing that free market works. They know that if we can see an opportunity for the problem with con laws has always been that we can never see. We can always see what's in front of us right now, all the problems right now, everything right now. But if we remove con laws in Mississippi, there's this fear that this is great unknown that is not being that we don't know what's going to happen out there. But we see in other states that these laws either don't exist or have been repealed, and we're seeing some great success. And so I think that. And also, like I said earlier, I'm not saying this is going to solve those problems, but hopefully if we can layer this with national policies around HSA reform and putting doctors back in the ability to open hospitals and layer in what we call the personal option, presenting healthcare more personally again, increasing telemedicine, increasing investments in technology. A lot of these laws inhibit a lot of the opportunities for investment. We want to see rural communities, urban communities get as much health care as possible, and we also want to dispel the myth that going to the hospital and going to the doctor I know from me growing up and a lot of folks I talk to, they're afraid to go to the hospital. They're afraid to go because they don't know what it's going to cost. So we hope that between this and other opportunities like price transparency and what I've mentioned with our personal option, we will see reductions in premiums. We will see reductions in overall spending on healthcare because we do think the free market works. And as Americans, nationally, I think the conversation around healthcare needs to focus back on the principles that made us the best country in the world, not ones where it's top down and trying to control the healthcare marketplace like in other places.
Are you going to lobby for laws or bill this year, I should say? We'd like to have a law, but a bill to repeal, at least partially or fully, the CON?
Yes, we actually had I've had conversations already, and there's actually a subcommittee coming up on con laws that we appreciate Speaker White's leadership on putting that together just to have a conversation about it. And I think we will see a bill come back. Like I said, I've never talked to a legislator who just absolutely flat out said that con laws don't need some work. And whether that's repealing just the standard areas like I said, birthing centers, mental health, substance abuse, or going further into equipment or, even hospitals like other states have done. There's a lot of options and a lot of opportunities, and I think that the legislature sees that. And as I've had conversations with legislators, I'll look at them and I tell them, before 2019, I had no hope that the healthcare industry could change. I had no hope that anybody cared about our healthcare industry. And now they have the opportunity, just like when I went out and found, I'm not the first person to discover con laws, but, coming back, like I said, 6 years of investment and working on this, I'm able to say we can see change. And for their constituents, when they see them, they want to know, how can we increase healthcare supply? How can we reduce the cost of healthcare? And how can we generally overall improve the well-being of Mississippians? And I think a lot of folks are interested in that. So we're looking forward to bringing some bills back.
Before we go, where does the lieutenant governor stand on these? We know where the speaker does.
Yeah, we have not gotten a direct answer on that, but we are hoping to have that conversation this year.
Okay.
I've heard rumors, but I'm not going to say those.
Okay.
But I hope that he sees, as a very smart guy and a great leader in a lot of ways, he can see this as an opportunity to serve his constituents and lead on health care, just like the speaker, and I know the governor has mentioned it as well.
Yep, sure has. Cade, appreciate you coming in. Thanks a lot.
Thank you.
Cade Yates, Deputy State Director, Americans for Prosperity, has been our guest discussing the Certificate of Need laws in the state of Mississippi. Stay with us, folks. We're coming back. Half an hour of talk left.